Hello,
Hi,
friends.
we are live again.
We are live for our second live session because you guys love the first one so much. And today we're gonna talk with Dr. Twyman, who is already
Here,
joining.
hi.
I hope he's
Great to have
requesting
you
to
here.
join so we can get him on here. 1 second. It should work now. Hopefully.
Perfect.
Hi,
Hi,
hello.
great to have you.
Let me just check the audio so we can hear you properly. Hi,
Hello, how are you guys today?
we're
We're great.
good. It's already 6 p.m. here, so it's like already pitch black outside. But other than
That's crazy. Yeah, it's only 11 a.m. Central Time, so
nice.
got a full day.
That's nice. Yeah, so I was just introducing the whole live session. This is our second live session. And today we're very grateful to have you. First of all, welcome. And to talk a little bit about stem cells. I think that's really interesting for a lot of
Super
biohackers
interesting,
out
yeah.
there. Also, the tibia, how those two might be connected to heart health, because you're a cardiologist and biohacker. So we have some questions for you on a
Sure.
beginner state to see where it leads.
And
Yeah.
to end it, if we still have a bit of time, we can discuss the whole topic of dosing, red light dosing a bit.
Sure, that'd be excellent.
We came up with the whole idea, basically just a little bit of background when we met you a few weeks ago, I think. And these were kind of the topics that came up. So we thought, why not make a live session of it and see if other people are interested too, basically. So it might be a weird mix to put dosing in there as well. But I think those are really important things to talk about today.
Awesome. Looking forward to it. So.
Awesome, yeah. So let's start it off. As Babsi already introduced you, really a cardiologist and also with red light therapy, as we photobiomodulation, as we mentioned, we have been talking about stem cells with you and the tibia and what it's all connected with heart health also. So let's start off. Would you like to explain to us what are stem cells basically?
So I should give you a little bit of background first. So I'm a board certified cardiologist here in the United States. I focus on heart attack and stroke prevention. So working with people to find their risk factors way before they have an event and try to mitigate any risk factors so nothing ever happens to them badly. And so kind of fell into the biohacking scene in 2017 when I was doing a long trip over to Asia, and the jet lag was going to be really bad, and found kind of the blue blocking glasses, and the jet lag wasn't so bad. So I realized that light really did affect your health. And then at some point came upon, low-level laser therapy, now photobiomodulation. I've been reading about that pretty intensely for the past year or so. Have a couple other, red lights that I play around personally, and now starting to try to teach my patients how to use it. I would say that the background is mostly it's for musculoskeletal benefits, but there's some interesting data that may help with some cardiovascular health as well. And so the background is I am a cardiologist. I am not a stem cell specialist by any means. I don't inject stem cells in anybody, so that's kind of for the regenerative medicine guys. So, but stem cells are essentially, cells that are kind of backups, so that when things break, the stem cells come to the area and kind of take over and kind of grow new cells for that area. During a heart attack, your heart's about the size of your fist, and you have 3 arteries that sit on the outside of your heart. If one of those arteries has an occlusion and it blocks the blood flow downstream, that muscle will die because it's not getting its nutrients. And then scar tissue will form in that area. So that's what an acute heart attack is. And so there was a very interesting study in 2018 in Israel that was treating people with ST elevation MIs or STEMIs. And they were using traditional care. These people got stents and such, and the usual, regular medicines for antiplatelets and anticoagulation and such. But they were treating them with laser therapy during the case, I believe it was like 1 day later and 3 days later. And these people had, interesting outcomes. So we can kind of go into that.
So cool. And when you use PBM with your patients, because you say you work in the prevention field, so before any of those events that you just talked about occur or happen, do you have a protocol? Do you try that out with them, or do you tell them about studies like you just mentioned? What's your approach?
Correct, and that's the thing is that photobiomodulation has been around since the late '60s, but the data, at least in the West, on how to actually apply it, it's not as clear. So so it is still very challenging. And I know we talked about the dosing issue. Is that I get that question often. Is like, how often do I do this? How far do I stay away from it? What wavelength should I be using? I have to tell them, like, you got to actually go back to the primary source. Like right now in front of me, I have the original article from Israel that has the actual study design, and so you have to look at that and try to recreate what they were actually doing in the studies to know if you're getting the same benefit. But fortunately, with red light therapy, it's uncommon that you're going to injure yourself with it. There is a biphasic response where no light, you don't get a benefit. You kind of got the Goldilocks, the right amount, and then too much, you lose the benefit. And if you keep going too far, you might get into the harm part of it. So there's pretty wide tolerance, but do you really tell somebody this is the exact dose? Most of the time you're kind of in the general ballpark. So I don't have an exact dosage for everybody. It really depends on what their goals are and what they're treating. But in this trial in Israel, the challenge is that there's only like 24 people. So how applicable is this to a larger population? They're going to have to do bigger studies, but they were basing it off of animal models in rats and dogs where they're inducing heart attack in these animals. They were directly treating the myocardium, the heart tissue, with laser therapy, and the scar tissue was less. So this was the first in man type of study looking at patients. And it did show that there's a blood marker called troponin. It's a protein inside your heart cells. And if the heart cells die, they kind of pop and spill all their guts out into the bloodstream. And that's how you actually measure the severity of a heart attack. And in this study, it showed that the levels of troponin were like 52% less than the people who were not treated with light therapy. Now, at 9 months, there wasn't a difference in the size of the scar tissue, so the heart function had returned back to normal with the person's lifestyle, their supplements they were on, medications, cardiac rehab. So both had the same outcomes at 9 months, but it's at least proof of concept that the laser therapy didn't injure the people and that there is a biological benefit, at least short term. Now, the long-term benefits aren't the same just yet, but it's plausible that if you give energy to the myocardium and the tissue doesn't actually die when it's ischemic, then you're going to have a smaller heart attack and less damage long-term. But the interesting thing in this study was that, I always thought that like you had to actually put the light, over the heart, but they were actually just putting it over the tibia, the bone in the front part of your leg, because the stem cells are very close to the surface of the skin at that point. So, so they were using 808 nanometer laser right over the tibia, so direct contact. So that's one of the big challenges too, is that a lot of the kind of consumer-facing red light panels, you're not directly squeezing the thing. You're going to be 6, 12, 18 inches away from it. So that's where the dosages kind of get a little bit mixed. But these were directly onto the tibia, 100-second treatments, continuous wave, and I believe it was 10 milliwatts. 10 milliwatts per centimeter squared was the treatment. And then they did 3 total sessions. Apparently, you get like 30% of your bone marrow will be irradiated with that light. So there are these mesenchymal stem cells that soak up the red light. They're activated by the light, and then they go to where there's damage. And if you're having a heart attack, those stem cells migrate out of the bone marrow, go in your blood, go to the myocardium, attach, and start trying to repair any of the damage that's there.
That's so interesting. That's basically kind of leading us into the second topic of this conversation as well, the tibia.
So why is it so interesting or powerful in this kind of situations or studies? Because you said this is a spot on our body that we can easily target basically with red light, right? Because it's so yeah, so shallow, so near to the
we can reach it better
skin.
than the heart, obviously. Do you have any suggestions, because not everyone has access to a laser maybe, but an LED panel from various companies out there? How would you suggest to reach the heart, the tibia, all of those topics that you just talked about in the best way?
So this is kind of the general recommendations, because red light is almost a pharmaceutical type of thing. So that's why I can't give somebody an exact prescription unless they're working with me. But is LED and laser equivalent enough? Likely, but again, they're gonna have to do more studies on this. So I like I said, I have multiple devices myself, and I kind of guide the patients that if they're treating their tibia, talk to the manufacturer of the device to see where is the kind of the EMF free zone, and then you're going to have to kind of plug and play with the parameters of their device. You need to obviously know the wavelength, you need to know the power, you need to know the spot size, and is it most of these are continuous wave, but there are some that are pulse. Most of the time pulse wave isn't necessary for the cardiovascular benefit, and then it's really the time. So how long are you doing these for? So like I said, in this Israeli trial, they're doing it for 100 seconds, so less than 2 minutes. And so you're going to have to do the calculation for your device to equivalent, touching your skin versus 6 inches, 12 inches away. You're probably going to have to, quadruple or 8x it, the treatment time. So maybe 15 minutes to your, tibia area.
Have you seen any, because I think this is a big question right now, is that with lasers, oftentimes you touch the skin. Of course, you also have reflection of the skin, but it is likely that more light goes into your tissue. And with panels, you have a lot of reflection, so likely, I don't know, 60, 70, 80, 90%. So you have to double or quadruple, as you say, the intensity. Have you had experience with that? So dosage with panels, for example, and could you see some kind of estimate that you need? Oh, sorry.
That was our stand.
that it needed to go higher with timing.
1 second. Please keep talking. I will just.
So yeah, it is one of those things that it's this is like nascent technology for this type of thing. Trying to take a trial that's using a laser and trying to break it down into a consumer-facing panel. I don't have the exact calculations, and I was a math major in college, so I can't even figure it out exactly. But you had said before, it's, the further you're away from something, you're going to get more radiance off the skin. In some of the courses I've taken, it's at least 60% of the red is being reflected off your skin. And so, if you think of the light as, a kind of a hose of water coming out, the photons of light are coming out, is it just dribbling out, or is it a fire hose blasting you? The more photons, the more you're getting absorbed. So, yeah, you do kind of got to know the parameters of the device. Then there's online calculators. I linked to one on one of my websites, redlightdoc.com. I have a link, and you can try and plug in these parameters and try to figure out, okay, this should be about the dose that you're looking for.
Let me just check. I think we got a few questions in, which is awesome and super interesting. Let me just see. How would I use my red light panel for these purposes? Heather, thank you for that question. I think we kind of got into that direction as well. So if you have an LED panel or a laser or torch lights, there are different devices out there. The first thing we would say is see what research says. And even if it's hard to translate from research to real life situations, because the design situation is always a little bit different, and from what your individual needs are, of course, you kind of have to find a balance, I would say. But broken down really, really easily, of course, everyone is different. If you're trying, for example, to heal your tibia after a break or some other, I'm just going to talk about tibia for now, you would then target the tibia and be pretty close, I would say, and start with 10 minutes. We see that between 10 and 20 minutes, there seems to be
This is also, I think, very interesting because when talking about dosing, I talk to a lot of people about dosing, and it's as we are also having this discussion, it's kind of like you have to see what fits for you. But what I see, and this is kind of interesting, especially with panels, there is this window like 10 minutes or so. It's kind of like a rule of thumb, and it seems to work for a lot of people for kind of like. General concerns
for the majority.
And so for me, this is super interesting also because what we see in science is there is a very low dosage usually used with lasers. So you have like, I don't know, starting from 6 joule to something like 50, 60, 70 joule. And with panels, if you have the calculations and even if you measure it with laser power meters, you roughly get like 50, 60, 70, 80 joule within a time frame of 10 minutes. So for me, this is always the interesting question nowadays is that maybe because now we start to get, okay, there is a lot of reflection, and maybe because in scientific settings, you can make sure that the light somehow gets to the affected area much easier, maybe, or much safer, that something like upping the time big time still gets you this dosage to the point where you need it or something like that. So this,
because you always have to keep in mind with lasers most of the time, as you also already said, you can reach the affected area or that point internally much easier, and with an LED panel it's more of an outside non-invasive treatment, which is different. So you keep that in mind. I would say next questions. How would you measure effectiveness? I think this is also one of our #1 questions that we get. Also, simple answer. I don't know what you're.
Let's ask you. How would you measure effectiveness, or how do you measure effectiveness?
Well, so I mean, I'd go back to the trial. I mean, they were measuring a blood marker called troponin. They're also measuring different inflammatory markers. And then they were using an echocardiogram, an ultrasound of the heart, to look at the size and function of the left ventricle. So they had, objective data that there was improvement. A outpatient who's doing this for kind of general wellness, there's probably not a great metric that you're going to be able to easily measure. So it's one of those things that, the course I took, they talked about, there is certain protocols that people could do just for kind of general wellness by treating their tibia and their sternum by activating the mesenchymal stem cells. And, it's just not a hope and pray type thing, but you're not going to have a lab metric or something else that you know for sure that, hey, this is absolutely getting benefit.
Yeah.
So is there anything, because this is also like, I think, a very big question in science. And as we get the question now, good, maybe like for general wellness, of course, I myself, I always do that. I measure like blood markers, like hormone levels and so on. And it kind of works for me, but it's something that is still expensive, and not a lot of people will do it. So is there anything like, how do you measure something like success with patients that you tried out? Is it also blood markers, or is there something like subjective perception of that something gets better, or like your that you see that the patient is getting better, basically?
And so this is kind of another nuanced question, is that each person's an individual, and most patients that I see are doing fairly comprehensive blood work panels at least every 6 months. So I have the baseline inflammatory markers, and for the ones that have atherosclerosis, I know how much plaque is in their carotids or coronary arteries. And then, if they're doing the light therapy, then yes, I'm, checking to see are things improving. But to be able to say it's all related to the light therapy, no, because it's a whole package. I'm changing up, how they're sleeping. Are they wearing blue blocking glasses? What is how much DHA are they getting in their diet? So it is a comprehensive package. Red light therapy is not the miracle cure. It's an augmentation for what Mother Nature can do. So I'm always going to recommend people use Mother Nature's sun to get through red light therapy. But you can use these panels to get an extra benefit. I think it's one of the things that it's for people who are generally healthy, it's going to be really hard to notice that there's a benefit. Maybe your skin's looking better, your hair's growing better. You can say, okay, it probably is getting a benefit. But I think it's probably more useful for the real sick people, because they'll notice that, their joints aren't hurting as much, or they have a cardiomyopathy, a weakened heart. They've been using their light therapy. They end up doing an echo later, and the heart function improved. You maybe have to contribute that the right light therapy had some benefit to that then.
Yeah. Absolutely. That's what I was going to say in the beginning as well, is the first thing that is really important to me personally. It might be really basic, but figure out what you want to better, or on what benefit you're working, because of course there are systemic effects, and we see that as well, because we have mitochondria in our blood, it travels through our body. But just shining a light on your body or onto your whole body and then thinking that it will fix everything, this is not how it will work. No. So it's much more a targeted process, I would say, especially in the beginning. So everyone kind of starts out with something. And if, for example, you're healing a tibia fracture, then of course...
Or something like heart health or cardiovascular health.
Heart health, cardiovascular health. You would consult with a doctor like yourself. You would find out what are important markers for that benefit or for that prevention that I'm looking for, and then kind of go from here, I would say. Would you agree with that?
Definitely agree with that. And, you can also kind of look at, from at least cardiovascular standpoint, what is your blood pressure to start with? One of the benefits, obviously, with, red light therapy is it's, knocking off nitric oxide from the cytochrome C oxidase, and then your blood vessels are going to dilate. And so if your blood vessels are dilating, you're going to likely have more normalish blood pressure. So if you have normalish blood pressures, it's probably working well for you. So I don't necessarily prescribe red light therapy just alone to lower blood pressure. There's a lot of other things that can benefit it. But if you're making a lot of nitric oxide, you can get some test strips and see if you're making nitric oxide that way. Or there's tests that measure your endothelial function. One of them's called an endopad. Maybe the red light therapy is augmenting that.
I think that's super interesting, because what we also often get is like the question, hey, when do I see something, like especially for people that are healthy or just want to get more optimal wellness, basically. And it's really hard to see immediate benefits, and especially if you do general wellness treatments, it's step by step, and you probably won't see a huge change from one treatment to the other. So I think it's kind of interesting what you say, that maybe measuring something like blood pressure or so could give you a sense of, hey, maybe it could do something. It's also what I do a lot is measuring like with trackers, and I can also see, like, if I stop for a week, do not do red light therapy, then do it for a week again, I can see my sleep changing or my heart rate variability changing. And so I think it gives me that sense of, hey, it's probably doing something. I mean, it could also be random, but like taking into account the studies that we see, and these not seemingly random patterns, it gives me some kind of confidence. That's interesting, and it gives you something to hold on, something so you will do it for some time to come.
I definitely agree with that. I mean, that's obviously this is where most people find out about this stuff. Is we follow some biohacker online that that's talking about improved skin function or testosterone or something. They're like, I'm gonna try it myself. And do they notice the benefit for themselves? So, it's kind of two classes. There's the biohacker or wellness person, and there's somebody who's really sick with cardiovascular disease. Honestly, I don't have that many patients who are super sick anymore, because I'm fixing them or preventing them from getting there in the first place. So the people who have really bad hearts, they're likely the ones who benefit more from laser therapy or light therapy. But I think the main benefit for somebody who's generally healthy, it's still probably the benefit on the musculoskeletal system, so that you're treating the inflammation, you're having less delayed onset muscle soreness, so that you can keep training, keep doing your strength training, keep doing your aerobic training, and so keeping your heart healthy that way. So I think that's probably one of the major benefits of light therapy, is that it lets you train without injury or recover faster from injuries.
That's a great tip. I love that. Especially in the prevention field, because me as a scientist, I'm doing my PhD as well right now, And I wanted to start out in the prevention field as well. And my professor was like, no, we can't do that. That's impossible to do anything, especially from a research perspective, because it's so hard to do and it's kind of impossible. So better find another topic. And it's so refreshing to me to see someone in the practical field with a medical background, with a research background, saying there is something you can do. You need to look at the bigger picture. You can find markers that influence other markers and go from there.
Correct.
That's awesome. So the summary, I think we've talked a lot about dosing already. What would you say is the summary? Like, what are the main 3 takeaways for you personally, or what would you recommend people to look out for when they're trying to achieve a correct dose in their photobiomodulation treatments?
So it still is a tricky kind of topic, and try to work with somebody who has experience with it. There's a lot of good companies that make the panels and such, and you want to make sure that they're transparent in what their devices can do. So you want to know what the all the settings are. I'm going to use the less technical words. What colors are coming out of the box. How strong is the box? If you write a message to the owners or the people making it, do they talk about some general guidelines like, hey, from 12 inches away, we've tested the EMF is 0 12 inches away. Never necessarily trust them, have your own meters if you can, but not even have like a laser spectrometer. But the basics are just, can you figure out what exactly is coming out of this box? Because a lot of times, you get what you pay for. So quality, sometimes it's going to cost you more. And then if you can, go to the original articles, for what you're wanting to treat, if it's a heart issue, what color of light, how long did they use it for, and try to match up a little bit what they're doing. The general guidelines of 10 and 20 minutes, those are extremely general guidelines. If you have a very powerful device, maybe it's 8 minutes. If you have a weaker device, it's 30 minutes. So it is, I know I'm hedging a little bit on it, but you want to make sure you're working with a company that has reputable devices and that you can bounce these ideas off of them.
Yes, absolutely.
Absolutely.
Agree. And I would add the same thing, the translation. I think the main thing with dosing is the translation from research, which is the only backbone we have, to real life and single person situations, basically.
It's really hard, I think, but I think it's also really, I would say, still very individual and a subjective thing, because what we see is, especially if we do not have a scientific setting that all of our customers do not have at home, it's a thing you have to kind of feel something happening. And what we often see is, like you said, hey, these guidelines, 10 to 20 minutes, could maybe be too much for you. And we oftentimes see that, for example, people that are in a position where they are not super healthy maybe, or where they have problems, we see that this is like 10 minutes could be too much for certain conditions, and they get something like a headache or so. This is sometimes it's related to not being properly hydrated, or maybe not having enough fuel for ATP production in your body. But yeah, it's something that we often get, and that we can work with on an individual basis, and then see, hey, maybe you need to start off lower, or maybe you need to get some water in before your treatment, and so on. So it's very interesting, very tricky. But the very interesting thing is that oftentimes when we do such one-on-one guidances, we can figure out really fast what could be the block here, and get it going again.
Yeah, I mean, and it is one of those things that it's, everybody has different mitochondrial engines, and if you have an extremely sick engine, just putting healthy light on it isn't going to be enough to get the engine to turn over again. And so those people may have headaches and not feel well with the light therapy. So you got to do more and scale back the light therapy and do it better, and then you can start stacking up more light therapy.
So maybe to sum up, dosing is a really complex topic. If you are interested in starting out with photobiomodulation, the main takeaway I think all three of us would agree on is finding an expert you can count on, you can talk to, or a community that you can talk to as well. And then kind of trying to translate research into your subjective situation.
And like you said, hey, we have this biphasic dose response, and it seems, at least what we know so far, it seems like this window is kind of big, and if you stay in some kind of bounds, real overdosing with negative effects for a lot of conditions is really hard to do. So I think it's a big plus, because as biohackers we like to experiment, and with a lot of biohacks we can definitely harm our bodies big time. But it seems, at least it seems so far, with photobiomodulation and with LEDs especially, it seems kind of hard to do if you stay within those bounds that we know, or realms.
Yeah, I agree with that.
Mm-hmm.
Would you like to add something to sum up the topic of dosing with photobiomodulation?
I would say, potentially check out my one website. It's redlightdoc.com.
Yep.
There's a link to a calculator on there where if you have the original articles, you can then plug in the numbers and try to get the dosage that's right for you for whatever device you currently own. I think that's probably the best place to start, is find a calculator and do the numbers yourself.
Yeah.
And also, I think what is really interesting to mention, I think it's on YouTube, right? Not on Instagram. You have a lot of great videos out there. A lot of really long form content that go into detail a lot. And so I love those videos. I watched a few of them, and definitely for all guys listening, this is something to look at.
Yeah. Definitely check our partner. Thank you very much for talking to us today.
Well, thank you for inviting me today, guys. This is great.
If anyone has any questions, I think now would be a great time, if we get some, to finish off with some questions. Otherwise, it was very nice to have you. Very nice to talk to you. And yeah, recommendation, contact Dr. Twyman down here, or contact us. We're a photobiomodulation company. We make our own machines, and we love to be in contact with everyone who's interested. And yeah, I would say we're very transparent about what we do and how we do it. So just let's connect.
I think this is something that is really necessary and important in this time we are in right now, in this stage, that we connect, that we discuss. And I think what I've seen in the communities, especially in the Facebook groups lately, is that a lot of people that may have kind of the same goals, issues, whatever, get together, try out different regimens together, and see where it's heading and what it does for each individual. And I think this is a really interesting time, especially to biohack in the sense of photobiomodulation, because you can experiment a lot.
Yeah.
And together with a few others that do the same, have the same goals, I think we can reach something like a level of understanding really fast now. Maybe not like the 30, 40 years that we have been doing research now, hopefully faster, yeah.
Yeah, it was really nice to talk to you. We will put this Instagram live in our Instagram TV. So for everyone who wants to rewatch it or wants to share it, feel free to check it out. And yeah, it was lovely talking to you.
So much.
Thank you guys for having me on. This was fun.
It was a lot of fun.
It was a lot of fun. Thank you so much. And thank you.
Talk soon, guys.
Bye.
Take care. Bye.